Hello, my name is Maria.
And my name's Melissa. Welcome to Dermal Talks. A few weeks ago on our social media, we asked you what you wanted to see on our Dermal Talks.
And we were inundated with a lot of questions about pigmentation, especially how to treat it.
So today we're going to discuss everything about pigmentation, what it is, how you can prevent it, and what you can do for the best treatment outcomes. Enjoy!
So I like to explain things in a way that people can envision it and relate to it in a simpler form. And what a better way to describe the visual representation and appearance of pigment than an iceberg. Now, when we see an iceberg, we only really see what's on the surface. We can assess how big, wide it is. But however, when we're wanting to treat pigment, we also need to see how deep the pigment is, as well as any shape irregularity. Similar to the picture here where you can see the tip of the iceberg. However, we won't be able to see what goes on underneath. But with this picture, for example, you can see that it gets a little bit more wide below the surface, followed by a gradual decrease in width. This idea also follows pigmentation. We don't know how deep the underlying pigmentation is until we actually start treating it. And often with the course of treatments, it is best to then reach optimal reduction in that pigment.
Hyperpigmentation is a result of the overproduction of melanin within the skin, often resulting in a patchy or uneven appearance. It can be caused by many internal and external factors. Internal factors include hormonal changes, medication, and the pigmentation left behind from acne and skin inflammation. External factors can include solar or pollution damage and sunburn. Treatments for pigmentation must therefore be tailored to the individual. We must take into account skin Fitzpatrick type, the cause of the pigmentation, current skin routine, medication, and the desired outcome. Quite the opposite of hyperpigmentation is hypopigmentation. This is the result of loss of melanin. Hyperpigmentation can be seen with vitiligo, albinism, and can be the result of injury to the skin. It is a complex skin issue and also one of the most challenging conditions to treat. Therefore, it is important to have a thorough skin consultation and even a second opinion prior to starting any treatment plan.
So as you can see, I like to visualize certain concerns to simplify it with pictures. So let's dive in and explain how pigmentation actually happens. It does get pretty complicated, so let's start with our good old friend and the topic of today, pigmentation. Our skin color is made specifically by specific cells called olli. Olli the octopus is up on screen. Otherwise, they're technically known as melanocytes. Olli likes to protect our skin from the damaging UV rays of the sun. Fair skin often has less color to their complexion compared to darker skin types. And I guess you can say that their ollies are not as active as those with darker skin types. Olli the octopus is in our skin and it can project and inject pigment into our own natural skin color when it needs protection. And then this can often cause a darker hue to that area. This is what we call pigmentation. Now, the reason why I've chosen an octopus to explain this, how pigmentation happens, is when you look at the melanocyte in itself, you can see how it does have tentacle-like projections. Now, when this goes under trauma, like an octopus, it releases ink, and that ink is now pigment. Think about it as an octopus using the ink as a defense mechanism to protect itself from danger. So when we apply our sunscreen, we are pretty much protecting our skin from the prolonged exposure or the dangers from the rays of our sun. So it is a defense mechanism that our skin then creates as a form of protection to any form of exterior trauma.
As you've probably gathered, we love analogies. We wanted to include some analogies in our episode today because they're a great way to simplify and help explain some difficult skin conditions to anyone. We're going to focus on hyperpigmentation as it is a common skin condition that affects people of all skin types. While skin discoloration tends to increase as we get older, there are a number of factors that can also contribute to increased pigmentation. These include genetics, skin Fitzpatrick type, sun exposure, injury to the skin, including burns and post-treatment inflammation, hormone imbalances, pregnancy, some illnesses and medications, and acne.
So the most common causes of hyperpigmentation are as follows. Sun exposure. The body produces more melanin to protect the skin from prolonged exposure to the sun. And this can cause dark spots or patches to the skin, often called age spots or sunspots. Sunspots or solar litigines vary in color from light to dark brown and have a very clearly defined edge. These spots can really creep up on you and pop up in your 30s, 40s to 50s. And they are mainly caused by UVA and UVB rays. So this is damage that has accumulated over the years from being in the sun. Sunspots and freckles can often be confused, but there's a big difference. Freckles often occur in fairer-skinned individuals and are genetic. Freckles are often lighter in color, smaller in size, and usually appears earlier in life. Both sunspots and freckles need sun exposure to appear. At the same time, we get exposed to the response when we tan in the sun, and inflammation being the color that we gain. So it's always important to know that there is nothing healthy about a tan. Skin inflammation. Areas of skin can often darken after people have had inflammation to the skin, also known as a tan in other cases. This can include acne, eczema, and high friction areas. So these tends to be common to the underarms and the groin, or even an injury to the skin. People with darker skin are more likely to develop post-inflammatory hyperpigmentation. And this can be typically seen when injury sites heal darker than the baseline skin tone.
Melasma is the trickiest to treat of all types of hyperpigmentation. It appears on the face as larger brown patches with a non-distinct fuzzy border. It can be caused by hormonal changes, pregnancy, certain drugs, and thyroid hormone imbalance. It is often symmetrical on the cheeks, chin, and forehead when compared to common sun damage. Although melasma can't be completely cured, it can be controlled with attention to lifestyle and active skincare. The condition is worsened with UV and blue light exposure, overheating of the blood, excessive exercise, some medications, hormonal fluctuations, and stress. Melasma can be controlled with regular skin treatments from your trusted clinician. Please be careful of treatments that are aggressive or involve too much heat, as this may cause a melasma flare-up. You can take charge of melasma by modifying your lifestyle and avoiding excess heat, such as hot yoga and saunas, and being very consistent with your skincare regime. Melasma can fade or sometimes disappear on its own, but without treatment or intervention, it may not. People can fade or reduce melasma in the same ways as they would other types of hyperpigmentation. However, melasma is a long journey that involves commitment to lifestyle changes, skincare, and treatments. Drug-induced skin pigmentation accounts for 10 to 20% of all cases of acquired hyperpigmentation. Pigmentation may be induced by a wide variety of drugs, but the main ones include non-steroidal anti-inflammatory drugs, antipsychotic drugs, cytotoxic drugs, and heavy metals. Some drugs may cause fixed drug eruption, which is followed by localized hyperpigmentation that can appear gray but can gradually fade.
A cause for hyperpigmentation is what we call post-inflammatory hyperpigmentation. And it is a bit of a mouthful, so let's just call it PIH for short. These pigmented spots are brown areas that appear on the skin after excessive trauma, heat, or infection. Burns, cuts, grazes, laser treatments on unprepped skin, or incorrect skin type Deep chemical peels, acne blemishes are common triggers for PIH. And as you can see, there's a lot of different things that can contribute to it. PIH occurs when the skin has been wounded or inflamed, causing the normal protective melanocytes to overreact by creating excessive pigments, which results in discoloration, often red, purple, or a brown mark. These marks are often described as scars, but this is technically incorrect as there's no collagen damage or tissue loss under the skin. If you have naturally darker skin tone, you are more prone to PIH. So you need to be extra cautious when receiving chemical peels, IPL, or laser treatments. To reduce the risk, we always recommend using active cosmeceuticals containing tyrosinase inhibitors. Tyrosinase inhibitors slow down skin enzyme tyrosinase that helps you make melanin. Tyrosinase inhibitors are present with retinoids, L-ascorbic acid, kojic acid, bearberry extract, and specific plankton extracts. It is recommended to use tyrosinase inhibitors for at least 2 weeks prior to any clinical treatments to reduce PIH risk.
In terms of skincare, solar protection is the key. Protecting your skin from harsh UVA and UVB rays that causes sunspots and triggers melasma is essential. So that means wearing your SPF daily. Implementing a consistent skincare routine that incorporates active cosmeceuticals will help to reduce hyperpigmentation and strengthen the skin barrier. Topical ingredients that can help to lighten pigmentation include azelaic acid, kojic acid, retinoids, vitamin C, and alpha hydroxy acids. In some cases, pigmentation is caused by damage to the skin, and you may need to use products with active ingredients at home to fade the pigmentation, like hydroquinone. Hydroquinone is often prescribed by a cosmetic physician or a dermatologist and are often a short-term solution, especially if the percentage of active ingredient is high. When used for a long duration of time, hydroquinone may cause thinning of the skin, so it's best to consult with a dermal clinician for a more long-term approach.
The trick to removing or fading pigmentation is to know which type of treatment suits the type of pigmentation you have. And this is where your dermal clinicians can help. For freckles, sunspots, and more superficial pigmentation caused by the sun, we know that laser pigmentation removal can clear the pigment with almost instant results. Generally, pigmentation caused by hormones or during pregnancy sits deeper in the skin, and we find that active ingredients and Pico or Q-switch lasers, which we will link below, penetrate deeper into the dermis, being the deeper layer of the skin, to help disperse or to shatter it. Not only are there lasers and light-based modalities, but skin treatments such as chemical peels, microdermabrasion, and skin needling that can help lighten pigmentation. Remember, treatments for pigmentation must be tailored to the individual by identifying the type of pigmentation and which form of treatment will be best needed to achieve the desired outcome.
So what is the end point? In some cases, dark areas will fade with treatments and topical agents. However, other forms of pigment will fade on their own using regular SPF. In other cases, more aggressive treatment is needed. There's no guarantee that the dark spots will fade completely, even with treatment. It is not to say that the condition won't go away, but rather will need management and long-term maintenance.
So in summary, hyperpigmentation is a common skin condition that can affect many people for many reasons. Though pigmentation is a harmless skin condition that people can manage using removal techniques such as topical creams or clinical treatments.
To get started with any form of treatments, it is best to book in with a dermal clinician where we can recommend the best treatment to suit your skin type and skin concern. This may involve prepping your skin first with a pigment blocker before starting light-based treatments. But if pigmentation is a concern and you aren't using SPF every single day, then that's the first thing you need to do.
If someone has multiple pigmented lesions, it would be best to have a mole map or skin check first. This is a physical examination to determine if the lesions are safe to treat. If a person notices other symptoms alongside hyperpigmentation, or they can see that the physical characteristics of the pigment lesions are changing, whether they're getting darker or where they may be getting bigger, they should always seek medical advice from their doctor first.
Thank you for watching Dermal Talks. If you have any comments or suggestions, please let us know below.
We've got our Facebook page where we post, I think, semi-regularly based on what you guys want to see. So feel free to follow us that on Facebook, Dermal Talks. We also have our own Instagram handles. Mine is Maria_Dermal Clinician. Mel?
And mine is Melissa.dermalclinician.
And when it does come to videos, please like, subscribe, comment down below. It really helps us to know what you guys want to see. And it definitely does help us put together these videos, kind of like our Q&A that we started off on Instagram. So until next time, bye.
Bye.